Patient is getting an indwelling catheter put in because she's going to surgery in 1 hour. Patient is mobile and able to move and adjust. Patient has no allergies.
Come in.
Hi, my name is Sydney. I'm a student nurse with Mount St. Joseph University. I'll be assisting your assigned nurse today. How you doing?
I'm good. How are you?
Good. Can you verify your name and date of birth for me, please?
Yeah, it's Joan Smith, 12/18/1950.
And do you have any allergies?
No.
And what would you like me to call you?
Mrs. Smith is fine.
Okay. Mrs. Smith, I am here to place an indwelling catheter. This is just for your surgery, which you're going to in about an hour. Since you will be under the anesthesia, then we do need a catheter just to make sure nothing happens during surgery. Have you ever had a catheter put in before?
I have not.
Okay. So I'll kind of walk you through it as we go. Before we get started though, I am going to just provide privacy and go ahead and check your bed breaks here. I'm going to check your IV. Okay, good. And do you mind if I use your table?
No, go ahead.
Okay. And I'm just gonna go ahead and put your bed up here.
Okay.
And then before we get started, I am going to have to lower your sheet here. Is that okay?
Yes.
We just got to do some assessments of your abdomen and your perineal area before we get started.
Okay.
Okay. I do have a blanket here for you though. Just to make sure you don't get cold. Put on some gloves here. Okay. And then I am going to have to lift up your gown and you will be a little exposed. Is that okay?
Yes. Abdomen looks good. I'm just gonna do a light palpation. You know if there's any pain or discomfort with any of this. Any pain or discomfort with any of that? No.
Okay, and pericare has been provided. All right, and before I do get started setting up my sterile field here, I am going to put you into the position that we're going to insert the catheter in. It's called a dorsal recumbent position. What I'm gonna have you do is bend your knees, and then go ahead and just let your knees fall to the outside, kind of like a frog. It'll just give me a nice open area to work with here, okay?
Okay.
Looks good. And then I am just gonna go ahead and place a pad underneath you. This is just to make sure if anything drifts, it won't get on your bed, okay?
Okay.
You said you are able to lift your hips and kind of move around?
Yes.
Okay, so go ahead and do that for me. Go ahead and lift your hips. Okay. All right, Mrs. Smith, now that we've got all that taken care of, I am going to go ahead and set up my sterile field here. It'll just take me a minute, okay?
Okay.
And there is just a bag just right by your feet. It's just for trash and everything during the procedure.
Okay.
Just gonna go ahead and get my gloves on here, Mrs. Smith, and we can get started, okay?
Okay.
Alright, Mrs. Smith, I do have my gloves on. That'll be a break in zero field because the paper touched my uniform. I would get a new kit. Alright, Mrs. Smith. The first thing I have here is just a sterile drape. Assistant, could you please lift up her gown for me?
Yes.
Thank you. First thing I have here is just a sterile drape. It's just gonna go right underneath you, okay?
Okay.
And then I have a second sterile drape. This one is gonna go right over you, okay?
Okay.
And then I'm just gonna go ahead and finish setting up the rest of my supplies, okay?
Okay.
Okay, Mrs. Smith. I've got everything set up. So since you said you haven't had a catheter placed before, I'm just gonna go over it real quick with you, okay?
Okay.
Okay. So what I'm gonna do is you're gonna feel my hand on your abdomen. I'm gonna go down, I'm gonna go ahead and spread your labia. You'll then feel 3 cotton swabs, 1 down each side, and then 1 down the middle. This is just to make sure that your perineal area and your labia are nice and sterile before we insert the catheter, okay?
Okay.
My box of supplies will be right in between your legs, and then what I will do is I will ask you to take a deep breath and bear down, and then I will go ahead and insert the catheter 2 to 3 inches or until I see urine. Once I see urine, I'll go ahead and insert it another 2 or so inches, and then I will inflate the balloon to make sure it stays in place. And then after that, we'll clean up, get it hooked to your bed, and get you off to surgery, okay?
Okay.
So again, my box of supplies is just going right in between your legs here, Mrs. Smith. And then, like I said, hand's gonna come on the abdomen, is that okay?
Yes.
And then down to spread your labia, is that okay?
Yes.
Okay. And 1 swab down the side. 2 swabs down the side. And 1 right down the middle for you. Okay, and then go ahead and take a deep breath for me.
Okay.
And bear down, and then I am going to go ahead and insert the catheter here. Okay, I see urine. Go ahead and, okay. Okay. Is all good to go, Mrs. Smith? All right, so now that it's in, I'm gonna go ahead and change my gloves, and then we will get you all cleaned up, okay?
Okay.
Feeling okay, Mrs. Smith?
Yeah, I feel
No
fine.
pain or discomfort with anything we just did?
No.
All right. Just gonna go ahead and rip this drape off. Okay. And then I'm gonna go ahead and take the box. Okay. And I see a downward flow of urine. Go ahead and have you put your feet down for me. Okay. We want to make sure we keep that downward flow. Just keep going down here. So I am going to attach it to your leg here, okay?
Okay.
This is just to ensure that it stays in place for you. Drape out. Okay, pericare is provided. I am going to go ahead and change my gloves, and then I'm going to go ahead and do another abdomen assessment before I cover you up here, Mrs. Smith, okay?
Okay.
Just to make sure we don't have any pain or discomfort with anything. Don't want that going into surgery.
Nope.
Looks good. Just a light palpation here. Any pain or discomfort with anything?
Nope.
Okay. Everything looks good. I'm going to go ahead and put your gown back down. And did you want to keep the blanket, or did you want me to take it with me?
You can take it with you.
Put that in the laundry. And go ahead and pull your sheet back up here. Alrighty. finish cleaning up real quick before I leave, okay?
Okay.
Still feeling okay, Mrs. Smith?
I am, yes.
Go ahead and just wipe off your table before I put your bed down real quick. Alrighty, and then I'm just gonna go ahead and put the bed down. Alright, Mrs. Smith, I'm gonna go ahead and put your table back here. And your water and your pitcher on the table. They should be in the next 30 to 45 minutes to take you out from surgery. You do have a call light on either side if you do need us for something. Just press that and we will be right in. Is there anything else I can do for you today?
Nope.
Okay. So like I said, there are call lights on either side. If you do need something, you just let us know, okay?
Okay.
Okay. Indwelling catheter was inserted with no problems. Patient tolerated well. Patient was able to lift hips and reposition to help. Patient is going to surgery in less than 1 hour. Patient was left in a clean, safe environment with the call lights in reach and the bed at the lowest position.
I filmed Cindy's video.